Lower back pain is a very common condition. In fact, it's probably the second or third most common reason for people to visit their primary care physician, sometimes from overuse, sometimes from a very trivial injury, typically pain located in the lower back. Usually we refer to it as muscular type pain, pain that does not radiate. Usually it resolves on its own, can sometimes take a few weeks, but the majority of people typically do get better with symptomatic treatment. So a laminectomy, if you picture like shingles on a roof, the lamina are basically shingles that cover the spinal canal. And so by simply removing one, it's called a laminectomy, and that opens up the spinal canal so that we can visualize the spinal sac and the spinal nerves that are on the inside. Most of the patients that we are performing laminectomy on either have a ruptured disc or herniated disc that's pushing into a spinal nerve, and we'll perform a laminectomy to open up the spinal canal to retrieve the ruptured disc. The other common cause is so-called spinal stenosis, which implies narrowing of the spinal canal from bone spurs. For instance, a patient with a ruptured disc, we can typically do that as an outpatient operation. Recovery time is probably about 6 weeks to get back to baseline. For a patient with spinal stenosis, they tend to be more elderly, and that can take about 8 to 12 weeks recovery time. Our goal with treatment is to open the spinal canal, take pressure off the spinal nerves, and allow the nerves to be unimpinged so that they may recover and hopefully get their leg pain to resolve. We typically do put restrictions on patients after an operation because you have to allow for healing time, and that's very key with any surgical procedure. You know, it's not like going in and getting your hair cut and you walk out and it's done. An operation is one step in the recovery process. We do have people do therapy. We allow time for healing. I do like to have patients progressively increase their activity level, but again, an operation is simply one step in the progression to recovering from an injury. Absolutely ask patients to seek another opinion should they like. I think just having as much information as possible to make an informed decision is very important in patient care. You know, at the university, we certainly see a lot of patients on second opinion, so that's not a problem for us. And obviously be comfortable with your decision, and we try and have shared decision making for deciding on an operation.
University of Iowa Healthcare. Changing medicine, changing lives.